Welcome to our point of care ultrasound course for physicians and practitioners. My name is Raimi Hutman. I am the program director of the Great Basin College Sonography and Radiology program, and I'm pleased to be here with you today to start sharing some of our information regarding ultrasound that may come in very convenient for you as you go out and start or expand your practice in point of care ultrasound. So welcome, and I hope that you find this course useful and is a really good basis to get started in your scanning in your practice. This course is designed to be offered as the first in multiple sessions that are going to address different areas of point of care ultrasound. So this particular course will be 8 weeks in length. It's going to meet the practitioner where they are. And by saying that, what we mean is that we know that you are all very, very busy in your own practices. And while you know probably that point of care ultrasound is a good addition to what you're already doing, it can be challenging to get away or put aside the time to complete this type of training. So due to the great generosity of the Helmsley grants, we have acquired a number of different portable sonography units that we are able to bring out to rural Nevada or other areas of Nevada where we can actually provide the hands-on training at a site either where you're working or at a location relatively close to where you may be working. So we look forward to completing that towards the end of this 8-week course. We also have prepared this course to promote knowledgeable use of sonography, which will enhance accuracy of practice. A lot of our physicians have recognized that because of their extensive anatomical and physiological knowledge, that people automatically expect to put an ultrasound transducer in their hands and have them know exactly what they're supposed to do, when they're supposed to do it, and why. We know I personally from a background in sonography know that that's not the case. And so if you've had experiences with ultrasound in the past that you've found frustrating, hopefully by providing you some of this background knowledge, it can help remove a bit of that frustration and make you feel more confident and competent in what you're doing. Another goal of this course is to evaluate the biologic considerations and improve practitioner education of patients. So as you know, as patients become more and more educated, you'll probably be encountering more patients that have some fear of medical imaging, including sonography. And so what we want to do is provide you with the content so that you can knowledgeably answer their questions, explain the biologic considerations of ultrasound, how we're using them, and how those considerations are incorporated into current practices we use today. Before we get into our first area of content, I just wanted to kind of prepare you a little bit about what to expect from the course. So every week you are going to have a module in your web campus class. If you work through your modules, one module per week, you should stay right on track and have no trouble keeping up with this program. Each week you'll have a recorded lecture. That lecture will be recorded by myself. You are welcome to reach out to me via email or phone anytime you have additional questions, need additional resources, or would like to provide any feedback about the lectures that you're seeing. You're also going to have intermittent quizzes or tests to just test your knowledge and make sure that you are retaining some of the information that's going to be most beneficial to you. We will also have a final at the end of the course where you can test your knowledge. Now, this is not a high-risk final. We want you to make sure that you are confident in the knowledge at hand. So if you happen to not complete your final with the grade that you're hoping for, we will give you multiple attempts to get up to a passing grade on that final so that you have confidence that you have met the objectives of the course. As I mentioned before, there's going to be an 8-hour training on site of supportive hands-on learning. We will be bringing out our equipment that is easily transportable to multiple different sites throughout Nevada. Most of these sites will be planned according to where our participants in this course are located. So hopefully no participant would have to travel over an hour or two to participate in this on-site hands-on experience with our technologist and instructor, Erica Salazar. So we will be scheduling those specific learning opportunities at a site near you towards the end of the 8-week course. So some of the content and the order of the content that we're going to present this information to you in is going to be, first of all, week 1, we'll start here with the origin of point-of-care ultrasound. Week 2, we're going to go into some of the ultrasound physics that may help you understand how ultrasound is working in creating your image and some of the applications that you can do as the operator that's going to improve your image and help your diagnosis. We'll also look at ultrasound modes, which would include our B mode imaging, our 340 imaging, Doppler studies, and spectral analysis that you can utilize in many different ways to help with your diagnoses. Transducers will be covered next, which is the operating component of our systems. And so it's very important that as practitioners you become aware of how their transducers are working, what they're capable of, and how to select the most appropriate transducer for your application and why. Then we'll go into scanning orientation about how to get your scans to fit typical protocols and how to evaluate Doppler feedback that you're getting to determine and look for any sort of pathology. Finally, we'll look at some operations of an ultrasound system, artifacts that may occur which would affect your diagnostic ability, and biologic effects. Lastly, so that you can communicate those with your patients better, and as well as take them into consideration during your own scanning. So to begin with the history of point-of-care ultrasound, we really reached a turning point in about 2001 when the American Medical Association came out and specifically said that ultrasound has a diverse application and is used by a wide range of physicians and disciplines. Ultrasound imaging is within the scope of practice of appropriately trained physicians. One of the areas that we see here is the terminology appropriately trained, and one of the findings we have in the feedback from physicians and practitioners is that for some reason there's been a gap in providing that appropriate training, leaving them feel unprepared in the field. So hopefully by taking a course like this and subsequent courses that you will find that you're feeling more confident in that training so that you can be acting within your scope of practice. The overall evolution of ultrasound in general and point-of-care ultrasound really started, they have history that draws the origins back to ancient Greece, but when we look at ultrasound as we know it today, we really saw evolutions in the development of sonar systems beginning after World War I. And they started utilizing those sonar systems to apply to real world applications, such as you see, looking for bombs under this ocean and things like that. In 1942, so closer to World War II here, we started seeing the first medical use of very primitive ultrasound equipment for diagnostic purposes. And that really originated in Austria, which continues to be a very important site for ultrasound today. Later in the 40s and into the 50s, studies differentiating sonographic differences between malignancies and benign processes allowed for better application and ability to use ultrasound for greater range of diagnostic purposes. In the 50s, they started trying to utilize ultrasound as echocardiography so that they could see the hearts more effectively and even utilize some Doppler studies that would show motion of blood flow in that type of physiologic response. And that really started in Japan. In the 60s and 70s, they started being able to produce rapid images, or what they considered rapid imaging at that point, and basically display those images in about a frame rate of about 15 images per second to give more of a real-time anatomic evaluation. Now, today, that would not really count as very real-time for us. It would be a lot of flicker on that image, but back then it was a huge step. Then in the 70s and 80s, we really started honing in on how to use ultrasound in different specialties. So the use of ultrasound expanded into radiology, cardiology as echocardiograms, OBGYN, and even emergency care, which is basically the grandfather of what we're doing today. In the 1990s, there was a big movement to promote FAST exams, and FAST stands for Focused Assessment with Sonography and Trauma. This exam was established in the 90s. Emergency and trauma physicians began using a very focused protocol, looking in its most basic form, looking basically for internal trauma causing bleeds. That exam was built on and has evolved a great deal over the last 20 or 30 years. In the 2000s, they started recognizing the effectiveness of ultrasound in point-of-care treatments. And so professional societies then started publishing practice guidelines for point-of-care ultrasound so that it standardized a little bit of the usage. Now, currently, now we're in the 2020s, we've seen this huge movement toward point-of-care ultrasound for a number of different reasons, including financial, time, patient expectation. One of the things that's made the point-of-care ultrasound more realistic is that they've become quite small and transportable. The prices of these point-of-care ultrasound systems are relatively inexpensive when we compare them to any other type of imaging equipment. For the size and the expense, they're relatively high quality, and fortunately, they're starting to incorporate some training, not just like we're doing today, but even into medical programs, so that as you're coming out of medical school, you have some sort of comfortability with your scanning, especially in coming out of certain residencies. You might have a lot of expertise in scanning that particular area. As I just mentioned, some of the professional societies there in the early 2000s really began getting involved in promoting guidelines and promoting the use of point-of-care ultrasound. One of the major players in these institutes was the American Institute of Ultrasound and Medicine, known as the AIUM. The AIUM has been very active in providing training guidelines as well as protocol guidelines for participants utilizing point-of-care ultrasound. Another society was the American College of Emergency Physicians, American College of Chest Physicians, American Society of Echocardiography, American College of Radiology, American College of Obstetricians and Gynecologists, and the Society of Radiologists in ultrasound. Now, if you're ever looking for additional information or guidelines or specifics, these are excellent resources to go to, and they can provide excellent guidance if it's an exam that you're not familiar with or you're not sure how to approach something and you want a really good protocol to start with to make sure that you're not just doing something but you're doing it right. Now, a lot of these societies and institutes have really worked together to develop consensus guidelines that they all agree upon. So it's really those consensus guidelines that drive some of our protocols today. As I mentioned previously, Accreditation Council for Graduate Medical Education now requires certain residencies and fellowships in the United States to include basic ultrasound education. So we're seeing people not being forced into ultrasound as they advance their careers as practitioners, but really coming from the ground up with that ultrasound training coming right out of medical school or their residency program. Now, as I mentioned, the American Institute of Ultrasound and Medicine, or the AIUM, has some excellent guidelines for point-of-care ultrasound. They also have some great guidelines for training requirements. If you go to their website, you can access all of those free of charge. We've also posted them in the module for you to take a quick look at, so you might find it especially helpful to look at some of the protocols that they have listed. Now, one of the things that we're going to notice, and I'll discuss again a bit later, is that the AIUM and all these other societies do recognize that one of the greatest limitations of point of care ultrasound, or really ultrasound in general, is its high degree of user dependence. So the more confident, the more comfortable, the more experience that the user of the system has, the more accurate they're going to be in their diagnosis. That being said, different exams have different levels of difficulty. So there is no one-size-fits-all requirement to get a practitioner to a competent level of scanning all point-of-care ultrasound exams. So some of the things that can affect the efficiency of the practitioner reaching that would be basically a lot of the incoming knowledge that the practitioner may have, maybe experience in ultrasound, definitely their anatomical awareness, their understanding of physiology. Those are going to make a significant difference in their ability to quickly acclimate to the use of ultrasound. The AIUM does recommend about 150 to 300 cases minimally under review of a supervisor or supervision to obtain competency level. Now, that being said, as I mentioned, some exams are much more complicated than others, and so it may only take 20 to 30 cases of, say, looking for pleural effusions, which is a relatively simple exam, versus maybe 200 or 300 cases looking for kidney stones, which is a more difficult exam. So there's a lot of flexibility with what gets a point of care ultrasound user to the point of competency, and so it's really important, because we are so user dependent, to recognize our own limitations and have patience as we work toward that level of competency. Now, one of the fears can be that point of care ultrasound is going to basically do away with the need for our regular complete ultrasound exams that are produced in our medical imaging departments. And really, that is not the purpose of point of care ultrasound exams. Really, our intentions from the point of care ultrasound point is to detect acute or life-threatening pathology in a very fast exam. This can be used to expedite patient care, and in order to keep those very fast focused exams, that means that the exams then are dedicated to a very small number of anatomical structures or organs. So for example, a physician might typically order a right upper quadrant or a complete abdomen ultrasound from a sonography department if their patient has, symptoms of biliary obstruction. Now, when we relate to how that would be completed on a point of care ultrasound level, they would just go do the gallbladder and try and identify the common bile duct. Whereas if they were to go have a full complete ultrasound exam, it probably would include the aorta, the liver, the pancreas, the common bile duct, as well as the right kidney, possibly the left kidney, and the spleen. So it's going to be a much more focused, specified exam, but it can be completed much more quickly to expedite that patient care. So complete exams through a medical imaging department, on the other hand, is much more thorough. It evaluates the entire anatomic region, but it is also much more time consuming to perform, as well as time consuming to get those the results back on. So many of you as practitioners are going to be very familiar with some of the clinical applications of point-of-care ultrasound, or you've heard anecdotal stories of how this can be helpful. And when you're looking at how you plan on utilizing it, you want to make sure that you're feeling very comfortable with the application that you're going to be using. But there's multiple areas of instruction that we can try and help you get onto the right track, and you can determine what your interest is in which of these you want to look further into. So the first type of goal and focus directed point of care ultrasound comes with procedural guidance. So things like vascular access when placing PICC lines, needle entry when you're doing or completing a thoracentesis or paracentesis. Those kinds of applications can be extremely easy and helpful under ultrasound. They provide you the image that sort of gives you that reassurance that you are where you want to be and you're avoiding organs or things that you don't want to be coming in contact with. Because this provides eyes to what you otherwise would be doing simply by feel, it reduces complications and improves success rate as well as practitioner confidence rates. Now there's also a very important diagnostic component of our point of care ultrasound. It's in the heart, gallbladder, for obstetrics, in the kidneys, aorta, bladder, veins. A tremendous number of different anatomical structures can be assessed with ultrasound. Kind of the sky is the limit, but what's important to know is that in order to accurately assess it, you have to know what normal looks like so that you can determine when you're finding things that are abnormal. And while it might seem apparent that it would be an obvious visual entity that you would see if it's abnormal, some of these are very, very subtle and can take a lot of practice in order to be able to identify. However, coming in with your extensive knowledge of anatomy, physiology, pathophysiology, it makes applying that to ultrasound so much faster and easier. So one of the things that is a frustration sometimes with ultrasound is it doesn't always give you 100% diagnosis. So certain things can be differentially or actually diagnosed with ultrasound, but a lot of times ultrasounds raises almost as many questions as answers. So the need for biopsies and other continuous studies on top of an ultrasound is still present. So this does not replace all of those other diagnostics, but it can certainly be a useful tool. So with ultrasound, it can be utilized in real time, which is a huge benefit. So we can actually, where a CT or MRI might actually be looking at still images, it can be difficult to assess what's happening in real time. So one of the benefits of ultrasound is that we can watch when we have physiologic changes in the patient. We can watch and see what that's actually causing to occur in the anatomy. So things for looking like for IVC collapsibility, left ventricular contraction, pneumothorax, hemothorax, all of those different things you can actually watch in real time, see how changes with respirations and valsalva and different mobility can affect some of these anatomical structures. Now, point of care ultrasound, especially for those of you that work in the emergency department, this may be of a special interest to you, but they can be utilized as a part of resuscitation. So patients undergoing cardiac arrest, this helps, you can scan live time, watching for things like tamponade, pneumothorax, PE development, clotting in the heart, to help you determine when resuscitation attempts may or may not become futile. And then finally, on a more general level, ultrasound can be utilized as a screening tool. The important thing to recognize when it's used as a screening tool is only as good as the operator. So the more experience you have under the belt, the more accurate you're going to become and the more successful you are going to become at using this as a screening tool. One of the things with ultrasound, like I said, not everything is 100% diagnosed by ultrasound. Lots of times it's more clues than it is an actual answer. So one of the dangers with using it as a screening tool is sometimes it can cause more questions than answers. However, in other applications such as screening for a AAA, looking for carotid plaque, things like that, that you might not be sure if the patient is in need of a full examination. Sometimes screening by the bedside can be a good indicator whether you want to send them to the next level, or if you think that you can wait another year or two before you go to those next steps. So lots of different clinical applications. The sky's the limit. You can use your imagination to determine how and where and why you want to be using this application. Just be aware that it's only as good as the operator. So as physicians and practitioners, you all have a tremendous amount of experience, training, knowledge under your belt. And one of the things that we've seen with ultrasound rolling out into the clinical application is that sometimes this is just handed to physicians with no specific instruction, and they're left to try and figure this all out on their own. And you know, as a sonographer, we usually do about 2,000 hours of clinical time in addition to didactic training, which demonstrates just the amount of time it takes with your hands on a probe to really become comfortable and in evaluating different parts of the body. And even with all of that training and additional numerous years of experience, is often that many sonographers are learning new things, seeing new things every single day. So the importance of training is not only important at the the imager level, but it's really going to be important at the physician practitioner level as well. So part of the purpose of this course is that the need for additional training was recognized when a foundation was doing some grant research. Most hospitals were reporting that either their physicians wanted more training or some training or any training at all in point of care ultrasound. And so we see from the physician and that the training is wanted. We see that really the training is needed because lots of times we have not provided that appropriately for a physician to go in and confidently perform these exams. So now, the caveat here comes with how much training is necessary, and the amount of training necessary is really going to depend on a number of different contexts. So first of all, if the physician has come out of medical school and has had a number of different experiences and uses of hands-on ultrasound, then they're going to come in and the training that they're going to need is probably going to be much less than somebody that's never touched a transducer before. The other thing is the variety of exams that practitioner is hoping to successfully complete. So if you are very focused in your practice, you just perhaps are in a clinical practice and you just want to scan for triple A's and carotid plaques, then you're probably going to take a lot less training than somebody that wants to look throughout the body for multiple different types of pathologies. Studies have shown that success with point of care ultrasound requires hand-on interpretation and didactic training, and that the discrepancies exist on goals and exact requirements of exactly how much of each of these the successful physician or practitioner would need. So ultimately, acceptable levels of competency on a specific exam can be reached with as little as 20 to 30 exams. So those might be something like the simple utilization of ultrasound to place a PICC line or your carotid evaluation for plaque. However, exams such as maybe looking for very small renal calculi, those are going to take a lot more practice because they can be a little bit more difficult or a lot more difficult in some instances. So depending on the goals is really going to determine how much training is necessary. And that's something that we are always willing to work with physicians on, look at what they feel comfortable with, look at what their goals are, and then really give very honest feedback into the level of competency that we're seeing. Ultrasound equipment. Ultrasound equipment is rather complicated. You might be asking yourself why we are recommending that you take a ultrasound physics and instrumentation course before you start a lot of the main content areas. And one of the reasons of this is that ultrasound operates on very basic principles that I'm sure with your extensive background and experiences will come very quickly to you. The utilization of ultrasound, because of these basic principles, can be highly affected by how we incorporate the principles of ultrasound into our scanning. So the difference between somebody that is scanning without a background or knowledge in the instrumentation, and the image quality of somebody that's scanning with extensive knowledge and understanding of this information is massive. And we know that when we get better images, we get better diagnosis. And so in order to prepare physicians and practitioners the best that we can to succeed, really we want to start teaching you these basic principles from the get-go so that you have all the keys to success when you get out there performing your exams. One of the things that has changed with point of care ultrasound over the last 20 years or so is that the size and the cost of ultrasound equipment has significantly decreased. So the equipment most of the time you're going to be using is going to be different than the equipment in your medical imaging department that is doing the bulk of your diagnostic exams. Those machines are large. They are mobile, but they within a particular site, but they are very large. They are very expensive. They have a lot of bells and whistles that you may not need in your practice. So because manufacturers were determining this need for more transportable equipment, they have come with, and I'm sure you're familiar with all of these, but laptop versions and handheld versions that plug into your phone. With all of that reduction in size and cost, however, comes a little bit of a disadvantage when it comes to image quality. So you want to make sure that you're familiar with your equipment, you know what it's capable of and what it's not capable of, and so that you have realistic expectations of what you're going to be seeing on that particular equipment. And really the transportability, the ability to save images, all things like that have really increased the ease of use for practitioners in trying to implement point of care ultrasound into their practice. Patient considerations, as you more than well understand through your experiences with ultrasound, just like any other medical exam that or assessment that you're completing on your patient, patient habitus has a significant impact. It's not just necessarily the size of the patient. Sometimes it's their fat to muscle content. Sometimes it can be due to their hydration component, how much gas they may have, a number of different things, but patient habitus has a significant impact on your scanning ability and therefore your assessment and diagnostic ability. It is important to note that utilizing the instrumentation and all the settings on your equipment can overcome a lot of the roadblocks that were previously encountered due to challenging patient habitus. Another really important thing with patient considerations is preparing for unrealistic expectations from your patients. Just like you know, miracles don't always happen with medications or anything else. The same sort of thing is true with your ultrasound. Just because you're able to place a transducer on your patient doesn't mean that you're necessarily going to have an answer for them immediately. And so providing patients with realistic expectations is going to be very important in your scanning practice. In addition, keeping your patients comfortable is going to be important. As you know, ultrasound, while it may look like a massage on the tummy or something else, as we hear from patients all the time, longer ultrasounds or ultrasounds on people of larger habitus can actually be quite uncomfortable. And so preparing patients for that and then being cognizant of what they're expressing with their comfort level is going to be important. But overall, the effective use of point of care ultrasound is going to provide for faster and improved care, with the one caveat that because it is so operator dependent, patient dependent, equipment dependent, that there is a high possibility of false positives. And so just keeping that in mind, if you feel like you do not have the appropriate equipment to accurately scan a patient with a difficult habitus, you know, it may open more cans of worms to even put that transducer on that patient than it would to be send them for official diagnostic imaging. So just a number of things to consider when you're deciding exactly how you want to be utilizing this technology. So in summary, point of care ultrasound, as you guys already know, or you wouldn't be here, is a useful tool in patient care and for all healthcare practitioners. Important note is that point of care ultrasound is very operator dependent. The more experience you have, the more competent you will become, and the more effective your scans will be. Operating early in your point of care ultrasound experience with a lot of humility is going to be very important, because there is a relatively long learning curve. Point of care ultrasound is very much patient dependent, and so have grace with yourself if you think you should see the exact same image on every single patient. That's not possible. That's one of the limitations of ultrasound, and so recognizing that and being okay with that and knowing when to cut your losses and send them to a different type of imaging is going to be important. We know that now medicine has really recognized the validity and importance of ultrasound in fast and accurate diagnosis, and because of that we've seen a lot of our medical associations join together working to streamline protocols and guidelines for training in our point of care ultrasound. And training requirements required to meet competency levels is going to be variable between people, between different practitioners with different goals and different levels of experiences and knowledge. So no one single training can fit all, and as part of this course we want you to feel like you can reach out to us with any additional needs that you may have, and give us feedback so we know what you need to experience to make this worthwhile to you. But thank you so much for joining us. We're really excited to be a part of this training with you, and we're here if you need us, so please let us know. Have a great day.